Michigan is now considered the current COVID hotspot in the U.S. The rise in cases is mirroring what the state saw in November, but doctors there say it feels like last April, with some hospitals even canceling surgeries to deal with the surge of COVID patients. Michigan's governor has now put voluntary restrictions in place, hoping to bring these numbers down.
We are seeing a surge in Michigan, despite the fact that we have some of the strongest policies in place, mask mandates, capacity limits, working from home. We've asked our state for a 2-week pause. So despite all of that, we are seeing a surge because of these variants.
NBC News Now correspondent Maura Barrett joins me now from Lansing, Michigan. Maura, good morning. Now, Michigan's governor wants the federal government to ship more vaccine doses to the state because of the surge in cases, but the White House declined that request. Why is that? Is Michigan getting any extra help right now? Tell us what they need and what they have.
Right, Savannah. So I'm at a vaccine center here that's just opening today and has the capacity to do 3,000 doses a day. But the governor's looking for more help when it comes to vaccines. The White House says they're not sending any additional vaccines to Michigan as of right now because they're sending as many available doses they can across the country, and any vaccines that they'd have to reallocate here would be taken away from another state. They are allocating more resources in terms of support for testing and people to administer those vaccines. But the governor obviously really pushing for this call because she thinks that the vaccines will be really helpful in this surge. Some health officials, though, noting that the vaccines, even if administered today, won't start protecting people until about 2 weeks from now. And so they're recommending that they get a surge of those antibody treatments that some hospitals could use, since we're seeing a surge in hospitalizations. Regeneron, one of those companies that makes those antibodies, said that that's not up to the federal government. It's up to the state to order those antibodies. So I've been in touch with the governor's office to see if they are ordering more of those treatments. They haven't gotten back to me on that request as of right now, Savannah.
And Maura, as I mentioned just a moment ago, on Friday, Governor Gretchen Whitmer announced the state would go into a 2-week pause, putting these voluntary restrictions in place. Now, this is much different from the strict rules put in place in Michigan over the past year that caused a lot of tension in the state. Tell us about this voluntary approach. Why make it not mandatory? What's she hoping to do?
Well, first off, just a reminder that Governor Whitmer was stripped of her emergency powers by state Republicans here back in December 2020 after we saw all of that pushback. And so her power is kind of limited on that front. But she is calling for overall personal responsibility with this 2-week pause, those voluntary restrictions of recommending that people don't go and eat indoors, that high schools that are in person go back to remote, and school sports recommended to go on pause as well right now because we are seeing a spike in these cases among younger individuals. And so while none of these are mandatory, a lot of health officials, again, are saying people are fatigued of these rules, those mask mandates. They're getting more, tired of having to wear the mask even as people are getting vaccinated. So it's that overall fatigue, even as we're seeing the spike in variants, that people are concerned about, and they don't even know if restrictions will be enough at this point. Savannah.
And Maura, it's obviously so disheartening to hear that in hospitals, some doctors are saying the situation feels like a year ago. Tell us what you're learning about the situation there.
Well, it's the rise in hospitalizations again that's feeling like that deja vu. The cases are rising, right, week over week, but the hospitalization rate is what we saw exactly this time last year, again, among younger people rather than those older people at 90% capacity. You mentioned some hospitals canceling surgery. I spoke with the public health commissioner down in Detroit to talk about how she feels about this moment and what she's trying to communicate to her constituents. Take a listen to our conversation.
We are right back where we were a year ago. And I'm really concerned with what I've been seeing. I know, we've done this before. We beat COVID, but now we need to double down. We need to still practice social distancing and wearing our mask and washing our hands. We know what to do. We just need to do it.
So again, there's a lot of frustration because they feel like, Denise even said there, she feels like a broken record when it comes to issuing this guidance to people across Michigan. But more so, they're worried that this is just going to be an example for the rest of the country in people getting back to travel and being fatigued about the restrictions. And they want Michigan not to be a precursor for what we could see across the country, Savannah.
It's a pretty clear reminder right there, though. We know what we need to do. We just need to do it. Even if you're sick of it, we just need to hold on a little longer. Maura, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.